All right, it is 7 o'clock. It looks like we've got a number of participants joining us, and I'm sure we'll have a few more trickling in, but we're going to go ahead and get started. So hello to everyone listening in. Welcome to our webinar. Today we're going to be talking about A Parent's Guide to Michigan Sex Education. Just a couple quick logistics about today's webinar. All attendees are muted. There are a number of you. We encourage you to ask questions throughout this presentation by typing them into the comment box. I'll try to keep an eye on them as we go, and there will be points throughout the webinar at which we can answer those questions. There will also be an opportunity to ask questions at the end, so feel free to type them into that box whenever you see them, and then my coworker Stephanie is going to be keeping an eye on them as well. This webinar is being recorded. I know there's a number of parents who are interested but couldn't make it tonight due to other commitments. So after the webinar, we will send out the link to the recording to the email address that you provided, and we'll also be sending out a couple of resources that we'll be talking about today. So the first thing I want to do before we start with some introductions is just do a quick poll. We'll have 3 interactive polls. You can participate or not. And this first one is going to ask who you're joining this webinar as, what your role is. So you can go ahead and answer that as I move on. So my name is Brittany Patel. I'm the Program and Engagement Manager with the Michigan Organization on Adolescent Sexual Health. Some of you may have heard of MOASH before. Some of you, this might be the first time. So MOASH is a statewide nonprofit. We've been running for about 11 years now. Our mission is to mobilize youth voices, engage community partners, and inform decision makers to advance sexual health, identities, and rights. We have a number of program areas that we're involved in across the state, including sex education. So that's going to be the focus of our webinar today. This has been a passion topic of mine for a long time. Done some work through MOASH in sex education, most recently with our Step Toward Equity program, which is teaching sex ed in an after-school program in Detroit. And then also doing some work helping build the capacity of sex ed advisory boards around the state. We've started in Washtenaw County, and we're branching out also in the Detroit area. We'll talk a little bit more about sex ed advisory boards later on. So this particular webinar is an offering we're doing through our Detroit Adolescent Sexual Health Educational Support Program, or DASHES. Big thanks to NIRH, the National Institute for Reproductive Health, for providing the funding for us to do this. And the program is built around supporting with building the capacity for the Detroit Area Sex Ed Advisory Board. So this webinar is a part of that. We're also doing some focus groups there. This webinar is designed to be for parents anywhere in the state. This is going to be general information, so no matter where you're located, you should be able to find some beneficial information included. However, if anyone is on from the Detroit area, we would love to hear from you. So feel free to reach out to us afterwards and let us know a bit more about what's going on locally there. There will be an email address provided. Right now, looking at our poll results, looks like about half are parents. Welcome. We've also got a number of health educators, health professionals, and then just other interested community members. So glad to have a diverse representation. Thank you very much for being on tonight. And we'll go ahead and jump into it. So just to set up some expectations for this presentation, we designed it to be able to address 2 main questions that we hear from parents. First of all, what is my child being taught in school related to sex education? To do that, we're going to look at sex education law in Michigan and discuss sex ed advisory boards, what they do and how they operate. And second, what is my role as a parent in the sex education that my kids receive at school? So in order to answer that, we're going to look at how and where parents have influence in school sex education programs. Just a quick note, this webinar is going to be designed around helping parents understand and get involved in what kids are being taught in schools. how parents can talk to their kids about sex, dating, relationships, etc. at home is another topic. We're going to touch on it very briefly, and we're happy to provide more support and resources for this, but that's just not the focus of today's webinar. Also want to acknowledge that people are coming in at different knowledge levels with this. So we geared this to be accessible for beginners. So speaking to parents, there may be others here in different roles, health educators. This might be repetitive, something you already know. That's great. So we're going for foundational knowledge in this. Some themes that we're looking at today that we're going to return to again and again as we go throughout are these three main ones. First of all, sex education is a very broad concept. We'll see how sex education in some cases goes well beyond talking about sex and can mean different things and look different in other settings. Second, we're going to see that there's a difference between state level requirements and local level implementation. So there are some statewide standards, but there's a wide variation on a local district level about what sex education looks like at schools. And third, parents have a big role to play both inside and outside the classroom in their child's sex education. And we hope to provide some information in ways that you can engage with that, whether you have a little or a lot of time to provide. So we'll go ahead and start with our first section, doing an overview of sex education law in Michigan. So first of all, a quick national picture. There's no federal mandate for sex education in public schools. The decision is left entirely to the states, and there is very significant amount of variation across states and even within states about what's being taught. We know that sex education in Michigan, we have a statewide requirement for HIV education, and that is actually required once at every building level. So HIV is taught in elementary, middle, and high school levels. It's kind of up to the districts about what grade exactly they want to implement that, but that's the recommendation of the state, is once at every building level. When it comes to sex education, that's optional, and it is left up to the individual school districts to decide whether or not they want to offer sex education beyond HIV education. If they choose to provide it, then it falls to the discretion of a local sex ed advisory board to review and submit the curriculum for school board approval. There are, however, some guidelines for Michigan sex education. So even if you make it optional, it still needs to follow certain standards. So some of the things that state law outlines in Michigan is that if it's offered in a public school district, sex education must not be medically inaccurate to start with. This is a little goofy language. Basically, we're going for all of the information that's taught is medically accurate. Second bullet point is that it must be age appropriate. So, for example, earlier I talked about HIV education supposed to be offered once at every building level. At elementary school level, you're probably not talking explicitly about HIV. What would be age appropriate is talking about hygiene, body health, how to clean up if you get a cut or a scrape, what germs are. So introducing these topics in an age appropriate way. And there are a number of standards about what is age appropriate that guide that, like the National Sex Education Standards, and we also have state level standards to guide that. Third thing is Michigan requires that we stress abstinence. So that means we talk about abstinence as a responsible and effective method of preventing unplanned pregnancy, and that it's the only protection that's 100% effective against unplanned pregnancy, STIs, including HIV. This is a little different than abstinence only. Some school districts choose to offer abstinence-only education. Some merely stress abstinence as one option among other options. And lastly, the state requires that we have to give parental notification. We're going to go a little further into detail on that later when we talk about parents' roles, but basically schools must let parents know that they're offering sex education, talk about what's involved in those classes, and also give them the option to exempt their students from those classes. If you're ever wondering or you want to go back and reference what Michigan standards are for sex education, one of the resources that we really love to use comes from the Guttmacher Institute. You can find this on their webpage fairly easily. They do a really nice state-by-state comparison about what the standards are. So here on this slide, you can look down to the bottom left corner and see that there's a circle around Michigan, and then look at the grid to see where Michigan falls. And it's really interesting sometimes to do this and see how Michigan stacks up against other states and what they have chosen to make a requirement and what they haven't. Some other requirements that we talk about in Michigan sex education are the A through K standards. These are a subsection of Michigan law. It outlines the minimum requirements of what must be taught if a state school district decides to offer sex education. And there are 11 requirements, and they're listed A through K. So when we say A through K, that's kind of what that means. Just to give you some highlights of what's in those 11 bullet points from the A through K standards. Included is talking about the benefits of abstaining for sex, or the benefits of returning to abstinence if somebody has already been sexually active. They ask any program to talk about the consequences of having sex. So these can include emotional, financial, legal, and health consequences, and that includes the risk of STI transmission and pregnancy. Another requirement is talking about state law as it relates to sex and adoption. So these commonly include sexual assault laws, criminal sexual conduct. There's something called the Safe Delivery of Newborns Law, which allows for the safe, legal, and anonymous surrender of an infant from birth to 72 hours of age to an emergency service provider, so a hospital, a fire department, a police station. And then they also ask that sex education programs talk about the age of consent law, which is 16 in Michigan. They also require that students are taught refusal skills, how to say no around sexual activity, and that it's wrong to take advantage or exploit a person sexually. There are requirements to talk about making sure students have a sense of personal control and personal responsibility for their behavior and decision-making. And lastly, the requirements include information on healthy dating relationships. Again, this is a Guttmacher Institute table here, which kind of outlines some of those things that we spoke about. So I can provide the link as well in a follow-up email. Let me quick check the chat. I think, did we have a question here? Having some trouble seeing that, so I'll let Stephanie put that through to me, and I can.
Yeah, the question is, what about consent?
Yes, so thank you very much for that question. Consent we are going to clarify in just a couple slides, so we'll get to that in one moment. Thank you so much. Some of the things that are prohibited, so the state law says that you cannot teach these in a school sex education program, include abortion, specifically that it cannot be considered as a method of family planning or a method for reproductive health. And teachers, administrators, any school staff cannot refer or assist a student in obtaining an abortion. So that's the requirement. There may be some gray area there. You could still potentially touch on abortion topics as long as you don't lump that in with other family planning methods, but it is a prohibition, and there are penalties in place in Michigan law if that is violated in a classroom. Also, the state says you cannot distribute contraceptive devices like condoms on school grounds. I believe we are one of 5 states that have this prohibition. So, as we've already noted from our audience, there's other things that are involved that currently state law doesn't have clear guidance about. So it's up to the local school districts if they want to include them in sex education classes or not. Consent is one of those things. So a local school district may decide that as part of their healthy relationships curriculum, they want to talk explicitly about consent, either sexual consent or consent in a broader sense, whether or not if it's freely given, that it needs to be sober, specific, reversible, verbal. They can choose to add that to their curriculum. The state doesn't require it, but it's an option. Other things that school districts might decide to include in their curriculum are behavioral risk reduction strategies. This can include condom use. So there's a prohibition against giving out condoms to students, but there's not a prohibition against doing, say, a condom demonstration of how it might be used by a teacher, just so long as those condoms don't get into students' hands. They can also talk about contraceptive devices or other birth control options, things like sexual orientation and gender identity. Plus, there's a range of topics that a school district might choose to include. And this is really going to be where sex ed advisory boards are going to make a big difference. We'll get to a part about that a little later on. So sex education, it's not just sex. At its best, sex education's going to cover topics that set a broad and vital foundation for students to develop into healthy young people with healthy interpersonal relationships. So oftentimes in sex education classes, we're talking about communication skills. How do we talk to people? How do we communicate our needs? How do we communicate boundaries? How do we look for people's boundaries in their words and in their body language, and then respect those? Other things that are involved are decision-making skills, hygiene, a sense of bodily autonomy and body ownership. Along with that comes a lot of self-esteem and emotional well-being. What is the relationship that you have with your body? How can you show respect for yourself and respect others? This is all built into sex education, and as you can see, it goes well beyond discussions of sex. It's really creating foundational skills so people can interact in healthy ways with the people around them. So those relationships might be sexual, romantic later on, but they can be platonic as well. So how do you have healthy relationships with your friends, with your family, and others in your life? Sometimes we talk about sex education is doing a kind of personhood development. So sex may end up being a part of that someday, but it's not completely sex-focused. In terms of curriculum options for sex ed in schools, it is again broad. There is a curriculum called the Michigan Model for Health that is created by the Michigan Department of Education, the Michigan Department of Health and Human Services. It is currently used by a majority of Michigan school districts in some capacity, whether or not they choose to use the entire curriculum or parts of it. It's up again to the local school districts whether they'll adopt, adapt, or disregard that curriculum and implement their own. So curriculum decisions for any school district are shaped by recommendations from the local sex education advisory board. So our next portion is going to start talking about what those look like, and I'm going to abbreviate to SEABs because that's certainly a mouthful. Real quick, I want to publish our second poll, which is just going to ask attendees about whether or not your district has a SEAB. So you can go ahead and vote on that if you're so inclined. So Sex Ed Advisory Board, or SEAB, is responsible for a few things. They establish program goals and objectives. So how do they define sex education for their district? And what do they feel a quality sex education program must achieve, include, what information, what skills? They put that list together. Second, they review and recommend materials and methods. This is something to differentiate. The Sex Ed Advisory Board doesn't actually approve curriculum. What they do is they have curriculum that they can review. They talk about whether or not they feel it would meet the program goals and objectives. They decide as a committee whether or not they would put it forth to the school board for approval. So they can only review and recommend materials, but the approval is up to the school board. The third goal for the Sex Ed Advisory Board is evaluating, measuring, and reporting progress on their program goals and objectives at least once every 2 years. So every 2 years would be seeing an update that says, hey, this is how sex education is going in our district. We've seen the following improvements. We have the following challenges, and to be able to publish that for the school district members to see. So then the local school board determines the terms of service, the number of members, and a membership selection process for the SEAB that reflects the school district population. Many districts are going to have a sex ed supervisor as well that's will be integral into coordinating the sex ed advisory board for that district. So now let's talk about who is on the sex ed advisory board. The law actually clearly outlines the requirements for membership. So this is something that Michigan law has already kind of fleshed out pretty clearly. They require that the sex ed advisory board have 2 co-chairs appointed by the school board, and they require that one of the 2 co-chairs is a parent of a child in the district. So we're already seeing parents figured very prominently. They expect that half the members must be parents of children in the school district, and the majority of those parents must not also be employed by the district. So that's basically saying they want half of the SEAB members to be parents, but the majority of parents can't be, say, teachers or administrators that the district employs. Other people that they outline that they want included on SEABs are students, teachers in the district, clergy members, and community health professionals. So from this, I learn a lot. I hear, based on these laws, that parents are extremely important. They're half the SEAB, so they're the ones who have a big vested interest in this. Also, I appreciate that the law tries to have a diverse perspective into what sex education is being recommended and reviewed, and they're also highlighting youth voice, which is so important. Young people, I would encourage anyone that if they're not already part of your programs, or if you're a parent and you haven't checked in, see what young people are saying about their needs and their wants of sex education. This is a big part of the work that MOASH does. We have a statewide advisory board because in order to provide effective programming for young people, we have to check in with them regularly and make sure that we're hitting the targets and hitting the topics that are most important to them. Last thing I'll mention about SEAB membership is that oftentimes SEAB members fulfill more than one of these roles. So say you might have someone on the SEAB who is a clergy member, but is also a parent of a child in the district. So a lot of times you get those doubling up of roles. SEAB meetings. Every SEAB makes their own meeting schedule, varies district to district. State guidelines recommend they meet at least twice a year. Some do more often than that, monthly or bi-monthly. I've been involved with the Ann Arbor Sex Ed Advisory Board, and that's a monthly meeting, so everybody's a little different in terms of what they can do. Co-chairs, the 2 co-chairs we talked about, are supposed to give members 2 weeks notice, either written or electronic notice, about when meetings are going forward, just so people know that's going on and they show up. So the curriculum review and later the approval process is kind of a main task of what the SEAB does. So it goes kind of like this. Curricula, materials, or other methods related to sex education are submitted to the local sex ed advisory board for review. Then based on whatever review method the sex ed advisory board has chosen, they review the lessons to see if they're aligned with their program goals and objectives. They meet together, they discuss, they debate, and then they decide whether they're going to recommend the curriculum to the school board for approval as is, with caveats, in part, or not at all. Before they go to the board, the SEAB is required to hold 2 public hearings for input or commentary on the curriculum they're putting forth for approval. Those hearings have to be at least 2 weeks apart. So this is built in, so parents, students, other community members, other people who are involved with the school district have a chance to go, to read through the curriculum, to ask the SEAB questions about it, to provide commentary before it's presented to the school board. So finally, the SEAB will request to be put on the school board meeting agenda so that the curriculum can be either approved or not approved. This process has to be followed regardless of the class in which sex education is taught, or the person providing the instruction, or where the instruction takes place. So, as you've heard, every local district is a little bit different in what their sex ed advisory board looks like, what their goals and objectives are defined as. So it begs the question, kind of, what do we know about sex ed advisory boards that are going on across the state? The last survey that we really did was in 2012. The Department of Education put it out, and they found the following things from the local education agencies, or basically the public schools that responded to the survey. Of the 88% across the state that responded, 92% had a sex education program, so assumably they had a sex ed advisory board. In terms of whether or not their membership was fully fleshed out in accordance with guidelines, some of the common themes they saw were a lot were missing students, were missing that youth voice, and a lot of them might have been missing clergy members. About 85% had established goals and objectives. A little more than half evaluated those every 2 years, and half reported attainment of goals every 2 years. So what I think we're trying to say is people are doing well across the state, and it's kind of hard to know what's going on the ground in most places. It's hard to say how things are functioning, and if we're not local, we don't know what's going on with membership, if people are meeting regularly. We don't know the last time that curriculum was updated or new curriculum was put forth. We're not sure what schools are actually using in their classrooms. So we really rely on local engagement and oversight with sex ed advisory boards. I just want to share the results of our poll here. Among the current attendees, we asked, did your district have a sex ed advisory board? We've got a significant portion who's not sure. Completely fine. This may have been the first time you're ever hearing of a SEAB. So we'll talk a bit later about how you can learn what's going on in your own district and basically who you can contact for that information. We have a few people who say, yes, we have a sex ed advisory board. It's not currently functioning. And then we've got about half of responses say, yep, it's up and running, which is great to hear. I want to check in. I think we've got, Stephanie, do we have a question in the Q&A?
Yep, we've got a question about if SEABs will cover all ages or if they're for specific age groups.
Oh, thank you. My understanding is that SEABs cover all ages. So whatever age you're offering sex education in a district. So it's going to go elementary school through high school. Yep. So now, and feel free if anything comes up. I know we just covered a lot. That was kind of the fast track through sex education law in Michigan and sex ed advisory boards. But if anything else comes up, feel free to keep those questions coming in. Now we're gonna shift a little bit and talk more about the role of parents. So what do we know about parents' feelings about sex education? According to a nationwide study that was done by a group called SEAB, which is the Sexuality Information and Education Council of the United States, we had a significant portion of parents feel that it's important to have sex education taught in both middle and high school. We also find that the majority of parents support comprehensive sex education. And by that, we mean sex education that goes beyond abstinence only. So it can include abstinence, and it will also include maybe behavioral risk reduction strategies, birth control, STIs, healthy relationships, sexual orientation, gender identity expression, puberty, all of these things. So a lot of parents are saying, like, yes, I feel like schools should be able to offer this. we want to make sure that kids are getting this information both inside and outside of the classroom. This is a national survey, but Michigan surveys that we've done with Michigan parents reflect similar numbers. There's an overwhelming majority of parents who feel that it's important to offer sex education programs in school. The Michigan Department of Ed is actually releasing a parent survey soon, which will include questions about whether you think sex education should be offered at elementary, middle, high school, what topics you think should be offered, when you think that they should first talk about certain topics, what's the appropriate age to do that. So we're really interested in engaging parents to hear what you need and want for your child's sex ed. I include this slide just to add a different perspective. I feel like oftentimes when we think about sex education, or basically when we hear about it in media, it's kind of presented as a controversial topic, that maybe parents are split about sex education in schools. And what we see with the statistics here is a lot of students are in support, and my guess is that schools administrators are hearing from a vocal minority of people who aren't comfortable with sex education in schools. So it can kind of feel like, it goes back and forth 50-50. The statistics that we see show that parents are often very supportive. We'd like to think of parents and schools being the sex education dream team. So I don't want to give off any perception that parent sex education and school sex education is any way antagonistic toward each other. As we've seen, sex education programs in Michigan are designed to have parents and schools work together and not at odds around providing quality sex ed. We see that in a couple different ways. First of all, we looked at the Sex Ed Advisory Board. At least 50% of those members are parents. Schools and districts want them to be involved. They want them to have a say in what's being taught. We want to support them in what they're teaching at home. Really, adult relatives and role models are children's first teachers. So schools want to be able to support them. And whether or not you're talking to kids explicitly about the sex, the values that you share with them are going to set a tone for their future relationships, both with others and with their own bodies and minds. School sex education is designed to be supplementary to what kids are learning at home. Oftentimes, sex education shouldn't be just one or two classes or one or two talks. It's an ongoing conversation. And parents are so important as being kind of like a follow-up at home. So say they had a sex education class that day, a lot of programs are designed to give them homework saying, go back, talk with your parents about this, learn more, see what they say. And it's important that they feel that they have supportive adults at home whom they can come to with these questions. The second way sex education programs are kind of designed to work with parents are with the parental notification laws. Schools use the opt-out method. So this is a requirement by the state. They must use opt-out. What this means is that anytime sex education classes are offered in school, schools must send out some type of notification to parents, be it a letter or an email, saying, we're about to do sex education. Here's what content we're covering. Here's the lesson materials. If you would not like your child to participate, please let us know so they can opt out. If schools don't hear from the parents, then the child will receive that sex education lesson. Parents have the right to be notified of the content of any lesson. They can request to review lesson materials in advance of the lesson. They have the right to observe any sex education lessons so they can be in the classroom. And they also have the right to remove their child from any lesson without penalty. There's even the option that parents can file a continuing written notice, which basically says a one-time waiver saying if there's sex education offered, I would like to exempt my child from that classes, and they will receive something else in lieu of that, some other lesson that is not sex education related. So with all of this, how can parents get involved? I mean, you're being invited in. We know that parents have a lot of demands on your time. So we decided to put together a list, and we've kind of ordered this from low to high effort based on what you're able to incorporate in your life. So the first way that parents can get involved is supporting your local SEABs. Learn more about what's going on with the Sex Ed Advisory Board in your district. Just get some information on who's involved in the SEAB. Are they meeting? When was the last time they recommended curriculum? What's that curriculum look like? So reaching out and finding out more. Once you find your SEAB, you can ask the co-chairs how you can best support the work that they're doing. They may have ideas. They may say, like, yes, we have a public hearing come up. If you'd like to join that and add in any comments, you're welcome to. So you can sit in on the SEAB public hearings. As we mentioned, there's going to be 2 public hearings that they offer, so people can look and make commentary on the curriculum that's being put forth for approval before it gets to the state board. The school board at the local district. You can request or recommend curriculum or topics to a Sex Ed Advisory Board. A note about this, a lot of times SEAB curriculum they try to do a review process for like kind of a full curriculum, but sometimes just one-off lessons can also be recommended for review. For example, in Ann Arbor, we recently reviewed a lesson on consent because that was coming up a lot as a topic, and we wanted to make sure that we're addressing that in Ann Arbor schools. So someone put forth a consent lesson designed around this video about how teas like consent. Some of you may have seen that. SEAB reviewed it, put it forth, did the hearings, and then it was approved by the state board. So sometimes you can just do small things like that that can be incorporated into existing curriculum that really makes a difference. Parents can provide comment in person or via email, and they can also attend school board meetings. A lot of times schools are going to have calendars of events and they'll include school board meetings. You can look at the agendas beforehand, so if you see that they're involving sex education, then maybe you can go in and provide commentary on that as well. And also, if you're really jazzed up about getting involved in sex education in your school district, you can request to join the Sex Ed Advisory Board. Everyone may have a little different application process, but many would love to have you and have your perspective. So finding out about your local Sex Ed Advisory Board, if you're not sure what's going on right now, the best way probably to find out about what's going on with your local SEAB is to contact the regional school health coordinator for your district. So the regional school health coordinators cover either one county or multiple counties. A lot of them are going to point you to the sex ed supervisor, but they'll know basically that contact information. So what we're going to do after today's webinar is send out a contact list of all the regional school health coordinators so you can find yours. I will also add in that we had a number of parents who are from the Farmington Hills area. We just found out that Dr. Tara Shami, or Dr. Tara Shami, forgive me, I'm not sure how it's pronounced, is the sex ed supervisor for Farmington Hills. So if you wanted to get in touch with them. And finally, another way to find out about the SEAB is to contact the superintendent's office, and they should be able to point you in the right direction. Other ways parents can get involved is to check in with your children. You may not know what they're being taught, so finding a time to ask them about, what sex education lessons they've received, how they felt about that instruction, what they want to learn, just getting more intel about kind of what's happening in schools if you're not familiar already. And then encouraging them to join their local sex ed advisory board. Many are looking for youth voice, so it's a great way to engage them in that. And then, of course, continuing to do sex education outside of school. So you can supplement what they're learning in their school districts with conversations at home. I say conversations as, again, we want this to kind of be an ongoing dialogue. It takes a lot of the pressure off of you to kind of do one big sex talk. If there are smaller talks interspersed, if they come up organically, say if you're just watching a TV program and there's a certain relationship portrayed, that can be a great conversational in. If you know that they just received a sex education lesson in school, you can ask them about it. There's a number of wonderful resources out there for how to do this as naturally and maybe as painlessly as possible, and we'd be happy to point you in the right direction for some of those. As a quick note to this, many students would like to talk to their parents about sex education. I think there's a perception that they don't want to hear from their parents, they're too embarrassed, and certainly these conversations can be awkward. If we knew how to make them not awkward, we'd be millionaires. But many students want to be able to talk to their parents. They're just not sure how to do it. So sometimes you kind of opening up that door takes a lot of the pressure off of them. And even if they're like, oh, I don't know how this is going to go, I don't know how I feel about this, it can be a really great way to start these conversations that they themselves wouldn't feel comfortable doing. Some more resources for parents. From MOASH, we've put together a number of infographics about sex ed advisory boards. One of the ones I'll attach via email after this webinar is shown here. This is the first page. It's just a 2-page handout front and back, and it's a Parent's Guide to Sex Education in Michigan K-12 schools, which reviews a lot of the content that we talked about today. We have a number of sex education resources on our webpage. So we're at www.moash.org, and you can find those resources there. For our program, Building the Capacity of Sex Ed Advisory Boards in Washtenaw County, a number of our community partners put together assessment tools to use. So if you're involved with the Sex Ed Advisory Board and you'd like a more formal assessment tool about how membership's going, how you're functioning overall, what your goals and objectives are, a lot of our community partners have put something together, and we're happy to provide that for you. Just contact us, send us an email, and we can shoot those over to you. And we're pretty much willing to help out in whatever way you need. If you want to get your Sex Ed Advisory Board up and running, if you don't have one and you want to start one, anything else, we're really open to it. I hope you'll reach out to us and we'll support in any way we're able to. Some other things beyond MOASH that are resources from parents come from the Department of Ed and Department of Health and Human Services. As we talked about, there's a contact list for regional school health coordinators, so you can find out more about your local sex ed advisory board. They also have some really nice online information, which summarizes a lot of that sex education law, policy, and standard stuff that we went over. So that's at www.mi.gov/HIV-ed. Before I sum up, let me double check. I've had a number of questions come through here. And let's see. How do laws and guidelines affect charter, private, and parochial schools? An excellent question. That I am less of an expert in. We do have information about sex ed surveys that we've done about the operating of sex ed advisory boards for charter and private schools, which I can get you that information. But I believe the laws and guidelines are going to be slightly different for schools that aren't public schools. So if you'd like to leave, for whoever asked this question, if you have a particular district in mind and you'd like to leave your email address, we can follow up with you offline about that. Another question we've got in here. Yes. So what happens if children don't have a supportive parent or caregiver, if they're in foster care, if the parent isn't available? So we're talking about parents, but that can be very broad to supportive adults. We would hope that most children are able to find a supportive adult in their lives, be it a caseworker, be it a teacher. So in order to try to coordinate those resources as much as possible. Another question, what are teachers taught about how to handle a child that discloses sexual abuse in the home? That is going to vary district to district about teacher training.
I think generally, though, if I can add in real quick, Brittany, teachers are mandated reporters. So while it would vary from district to district, I would say it depends on how many details are provided and what the policies are, but there probably would be some reporting in place.
Mm-hmm. Thank you. Question, is there a requirement for how far in advance before a lesson parents need to be notified? I cannot remember offhand, so I can look up that information. For some reason, well, I'm not going to guess. What are the qualifications of the teachers presenting the material? So Michigan does have necessary qualifications for health educators in school to prevent sex education material. What I can do is send out a summary sheet from the Department of Ed talking about what those qualifications are, what training they need to receive. Another question, to clarify, gender identity isn't included in Michigan curriculum laws. That is correct. Gender identity would be a topic that's left to the local sex ed advisory boards to decide if that's one of their program goals and objectives, and whether or not the curriculum in that district would include that. I would also mention that gender identity may be a little separate topic from sex education. We oftentimes like to differentiate the concept of gender identity from sexual orientation. Someone asked about who the chairman of the Farmington Hills Sex Ed Advisory Board. I'm not sure about the co-chairs, but the sex ed supervisor for the Farmington Hills district was Dr. Tara Shamey. Last question I'm seeing, when do you recommend to start talking with children about sex education, and to what extent? My daughter is 5. So as we talked about, sex education is a very broad topic. So really, sex education, in a sense that we're talking about communication skills, we're talking about bodily health, kind of starts from birth. In terms of age-appropriate subjects, there's a lot of wonderful guidance that you can find for parents, talking about what age you can expect them to ask certain questions, how to start presenting information about bodily autonomy, boundaries, decision-making, hygiene, those type of topics in a way that's appropriate for their developmental level. We'd be more than happy to send that out. Other questions? Does it have to be a teacher, or could it be an outside agency to give the consent or healthy relationship education? So there are guidelines about guest presenters coming into schools. And again, that can be an outside agency. They're able to do that. I can send you the summary sheet of kind of what the approval process is for bringing in guest presenters and what their certification needs to be. Question, do you have a list of sex ed programs that are available other than the Michigan model? There's a lot of curriculum out there. I think it would be, I believe you can find lists of different curriculum that is offered. I don't have a list of, say, curriculum that's being used across the state of Michigan besides the Michigan model, because it varies so widely from district to district. I know that in some of the work that MOASH has done, one of the things we've referenced is that Advocates for Youth, which is a national organization, has a comprehensive online K-12 curriculum, which is free and downloadable and able to be tailored to any district. So that's one thing that's available to anybody. But there's so many different programs out there that I don't have a list offhand. Okay. Stephanie, did I cover everything? Just looking at our list here.
I think so. We'll just need to put the link for the Ann Arbor education video, but we can do that at the end.
Okay.
That you mentioned. But I'm pretty sure that's everything.
Okay. So just a quick summary over some of the things that we covered today. Please let me know if we haven't covered it. But we're hoping to address 2 questions. What is my child being taught in school related to sex education? As we can see, it varies district to district. On a local level, it can look very different. So the only way to really be sure about what's being taught in school is to make those connections with the local sex ed advisory board or with health education teachers or with the regional school health coordinator to see what curriculum is currently being implemented in your community. Second of all, what is my role in the sex education they receive at school? You have a number of options. The Sex Ed Advisory Board is very welcoming to parents. They want to hear from parents both on their board, at the school board meetings. They'd love to hear from students. So if you can engage your children to be involved and have a voice in the sex education they received, it's a wonderful way to get involved. So parents have a huge role to play, and we hope we've kind of built your sense of agency and empowered you to get involved. So themes to revisit, just making sure that these came through. Sex education is a very broad concept. It involves much more than sex. It starts young and is an ongoing process of learning, growth, and development. Second of all, there's a difference between state level requirements and local level implementation. So the state does have standards for sex ed, but what those look like at a local level varies widely. And finally, parents have a big role to play both inside and outside the classroom in their child's sex education. There's a complementary process between the sex education that might be happening in schools and the sex education they receive for you or other supportive adults in their homes or in their communities. One last poll that I'd like to implement as we wrap up the day. We're just curious about, after hearing this webinar, how you might plan to get involved with sex education in your school district. So you can take a moment to fill this out. We hope we've answered some basic questions for you today. We hope you've gotten something out of today's webinar. It sounds like we've got a number of good questions to follow up with, more in depth than we can do with the time that's allotted to us right now. So we hope that you'll reach out to us with anything additional. After this webinar ends, you can expect to find a recording in the email. We'll send out a contact list of the health coordinators for all the different districts around the state. We'll send out an infographic summarizing this material, as well as a little deeper summary document into what sex education looks like at the school level, which will include information about guest presenters, outside agencies, certification. If you have any questions about MOASH specifically, our thoughts and feelings about sex education. I would also direct you to our position statements online that we've put together for comprehensive sex education, as well as the resources. So looking at this poll, it looks like we've got some SEAB members. Thank you for being on. We'd love to hear your feedback. Your experiences are really important for us to hear, for others to hear about what is going on at the local level in sex education in your area. We've got a number of people who are going to reach out to their young people to hear about the sex education that they're currently receiving in school or they have previously received. Got people contacting the regional school coordinator and sitting in on meetings. Well, thank you so much for everyone being on. If there are no further questions, we'll go ahead and end the webinar. Thank you so much for your time and have a nice night.